It's once again time for the daily briefing on KLAM and KCDV, where we take this opportunity each weekday to kind of see how things are going with the city's COVID-19 response. 1 p.m., 5 p.m., and 8 p.m. on the radio and archived on our YouTube channel, which is youtube.com/Cordova TV. And not just this current one, but all of the programming we've been sharing with you, COVID-related, is archived on that channel. Mayor Koplin is our guest, so we'll roll that conversation for you now here on today's Daily Briefing. Mayor Koplin, again, nice to have you with us here for this briefing, and we're going to be reviewing some material a little bit later, but I was wondering if we could start with this, what's being called a dignitary visit. Some interesting folks have come to pay us a visit.
Absolutely. Yeah, it's a big, exciting day for Cordova.
All right, so who's coming and what's the plan?
So from the federal side, we're going to have Dr. Alexander Eastman, which is the Chief Medical Officer for Homeland Security, and his Chief of Staff, Jeff Burks. From the state delegation, we're going to have Dr. Ann Zink, of course, Alaska's Chief Medical Officer, and Mr. Ben Stevens, the Governor's Chief of Staff. And then from the Alaska Native Tribal Health Consortium, Bob Anders, who's the CEO there, and then his executive assistant, Savannah. And as you can hear from the dinging in the background, my phone gets pretty busy.
Oh, yes,
and,
I imagine.
Then we'll also have Heidi Hedberg, and she's the Deputy Commissioner of Health and Human Services from the state of Alaska. So that's the team of 7 that's coming to visit. Okay,
and then who are the locals that will be accompanying them or spending the most time with them while they're here?
So directly, it's going to be Dr. Hannah Sanders and myself, and then Helen Howard, their city manager. And we'll be arranging to pick them up and take on the tours of the facilities and so forth. And then we'll pull in some other community leadership as we go. Greg Meyer, the director of the CCMC Authority Board, Bert Adams, the director of Native Village of EAC, doctors in our team, Dr. Rush from the Alaka Clinic, and Dr. Blackadar, who's supporting us in emergency efforts. Of course, our city manager, Helen Howard, and our incident commander, Paul Trumbley, who have really been spearheading what's being seen kind of as the gold standard statewide in terms of incidents response for this pandemic. So about 18 total will end up visiting, and then maybe Alex Russin from the superintendent of schools as well.
You know, it's interesting. There was a question that probably deserves some attention as to when you bring somebody in from out of state. Obviously, we have these various mandates about quarantining and so forth. I have no idea whether Dr. Eastman has been in state for 2 weeks or quarantining or anything. But when that question gets posed, what would be the answer to that? Why would Dr. Eastman not need to do the 14-day quarantine?
Well, that's a good question, and it just kind of underscores what our incident commander, Paul Trumbley, keeps repeating, that make sure you understand the mandates. In this case, there's an exception for medical professionals coming into the state from out of state. And frankly, the free flow of doctors and medical staff, as well as medical supplies, obviously is a very critical response aspect of this. So, for example, if you have a emergency hospital, National Guard or something come in to help up, you don't want to have legal barriers for them to do that. So he's exempt in that regard, but I can tell you we're treating it exactly. We have to treat every case from out of state as if they're infected, or in his case, as if they could get infected. So we're going to have very, very tight protocols from the minute they step off their plane until they step back on the plane. To make sure that we're taking excessive measures to make sure that, importantly, so that there's no chance that they can infect the community.
Okay. Well, that's it. And it's funny because I didn't think about that when I was, I assumed that he was being tested multiple times, and mainly that if Dr. Zink is the one mainly shepherding him around, that they would be taking those precautions. But it's a good point. There is a specific exemption for doctors and nurses and people in the healthcare field who presumably would know more than the average person what they should be doing. So that's an interesting perspective.
I just wanted to mention that since you brought it up, yes, they do testing. That's part of the protocols for traveling, not only for people inbound. Very likely they'll test not too long after they visit. For myself, it was a suggestion, and I'm going to do it, that I will also test because I've been, even though I'll be following all the distancing rules and everything, just as an added precaution, since I've engaged with someone from out of state, I will be getting tested later this week or early next week, just as a precaution again for the community.
Okay. What about our latest testing numbers and so forth? We usually like to include those in there somewhere.
So to date, we've had 200 tests conducted. And again, we've had one active result, 194 negative results, and 5 of those results are pending. And we now have a bigger capacity since yesterday of 1,100 tests. Remember that we are still offering the free drive-up testing to anyone who's arrived from Cordova, from out of state within the past 14 days. And that schedule again is Wednesday, today, from 2 to 4 at the Alaka Community Health Center. And that's downstairs across from the Episcopal Church. And then Thursday and Friday this week from 2 to 4 p.m. at the CCMC Ambulance Bay. So please call ahead to schedule. It'll save you time and it'll save clustering. The Alaka Community Health Center's number is 424-3622, and the CCMC number is 424-8000. And you can pre-register. It'll save you time, and it'll basically boil down to a drive-through. If you can't access those times, they'd be glad to make arrangements. And again, just call those telephone numbers. They can accommodate your schedule. So how long, people are asking, does it take to get test results? It depends on the type of test, but it can range anywhere from a half an hour or more to 1 to 2 days. Then we encourage, again, the community to recognize that testing is positive progress. It empowers the community and our medical team and hopes to increase the amount of testing in the coming weeks with the assistance of the state of Alaska, because it's our biggest tool in identifying and preventing spread. So we do have a new health mandate that we're already getting a lot of questions about, and intra-state travel between communities located on the road system and or marine highway system is now permitted for all purposes. So that means travelers can travel between road system and the marine highway system communities and via any normal means of transportation, including vehicles, boats, ferry, aircraft, commercial aircraft carrier, and you do not any longer have to be an essential worker to do that. For Cordova, we really don't expect a lot of that kind of traffic yet. Once the ferry starts running in the first week of July, and then, of course, there's sport fishing, if and when that happens, we expect more of that kind of traffic.
Okay, and this, when you said we have a new mandate, this is not a Cordova mandate, but one that came out at the state level, right?
It is one that came out at the state level, but it is one that includes Cordova because we are connected by the Alaska Marine Highway System. So it does apply to Cordova. Okay.
Now, maybe a quick review of the rules that are in place, the ones that matter during our yellow phase here.
Sure, and we'd already talked a little bit about the dignitaries visiting, but we do want to give a shout out to the food service staff at the Cordova Community Medical Center. Every day they're delivering 80-plus meals to our seniors and elders in the community. And then the rules that we have in place, and I remind that we are in a yellow phase of reopening. The quarantine rules, anyone arriving in Cordova from out of state, including the residents of Cordova, if you leave and come back, must quarantine for 14 days. The only exemption is for essential health care and emergency services employees. So that's what we had just talked about earlier, the health care exemption.
Okay.
Wearing masks is required in Cordova. I've been so happy with the compliance that we've seen down in the harbor and in my tours with the doctors, and I really appreciate those in the community and that have traveled with the community following that. Everyone does need to wear a mask at all times on the docks, in the harbor, in public places, and local businesses, including the gas station. And remember that it protects you somewhat, but more importantly, it protects those around you. I'd also like to give a special thanks to the Marketing Association and CDFU for providing masks to the fishing fleet. Another example of Cordovans helping Cordovans. And social distancing, gatherings of no more than 20 people are now allowed, but they have to maintain that social distancing of at least 6 feet. So we are in operational period 10, which means it's the 10th week of this, and I know it's dragging on us, but that just underscores the importance of following the rules as we get real busy in the harbor and kick off our fishing season. So please be respectful of these measures that have been put in place by the state, the city, and also some measures by the local businesses as they strive to serve our community but keep them, their employees, and each other safe. And that's what I have for today.
Okay, well, thank you again for the time. We appreciate it. You stay safe, and I hope everything goes well with these folks that are coming to see. Again, from what it sounds like, how it is that Cordova is managing to be, as really we are a lot of times, to be a model for the rest of the state. That's got to make you feel pretty good.
It does, and even though we get a little frustrated and we would like to see things be better and there's a little piece here and there, the whole community gets engaged. They don't stop at, what is the city doing, what are others doing? Then they jump in and start trying to be the solution themselves, that had some early frustrations with that, but the community is so engaged and so protective that it's a good thing and really it's a model. So thank you, and I'd also encourage, as Dr. Sanders said, to get out and exercise and enjoy the sunshine.
Thank you again to Mayor Koplin for joining us for today's daily briefing, as he does pretty much every time it's time to have one. We've appreciated having his time. And yes, some of the information does get a little redundant, but the repetition is what hopefully makes it stick. That's the theory anyway, so appreciate you tuning in to see what the mayor had to share with us. And we do this in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio. The archive is on our YouTube channel, youtube.com/Cordova TV. If you want to share the audio somewhere so others outside the community can hear it, or if you want to be able to listen to it again, just send them a link. We're happy to have them as a guest. And you can subscribe to the channel. Robbie tells me that if you do that, first of all, it doesn't cost anything, of course. But if you do that and then click that thing that looks like a bell, then your phone or your computer or whatever will notify you when a new program goes up. Which I should probably do, just to see if it works. Thanks again for listening. We'll get you back to regular programming now on the Calamity Eagle.